can put it in the chat box and we'll try and pick it up as we go. And at the end of this, we will be asking for your opinion on how the session has gone. So you will be asked to complete an evaluation form, and we hope you don't mind giving us your comments. So I'm going to ask the team that is working in South East London and overseeing this session just to introduce themselves very briefly, and then we'll go into the speakers. So Lotta, can I start with you, please?
Hello there. Hi, my name is Lotta Hackett and I work for the CCG in the Central Engagement team. Thank you.
Gurdev?
Hi everyone, my name is Gurdev. I'm working very closely with South East London ICS on the Equalities Programme and the maternity campaign.
Olgie?
Hello everyone, my name is Dr. Oge Losway. I'm a GP based in North Central London, and I'm also one of the clinical advisors to the London Region COVID vaccination programme.
Thank you. Jackie?
Hi everyone, I'm Jackie Kempen. I'm a midwife and maternity project manager working across the South East London local maternity system.
Thank you. Jenny?
Hi everyone, I'm Jenny McFarlane. I'm the engagement manager and I work for the central office for CCG. Thank you.
Thank you. Zara?
Hi everyone, my name is Zara. I work for the comms and engagement team for the central team in South East London.
Okay, Gurjinder?
Hello, I'm Dr. Gurjinder Sandhu. I'm a consultant in infectious diseases at King's College Hospital.
Okay, is there anyone from the South East London team that I haven't mentioned yet? Okay, fine. In that case, let's make a start on this afternoon's session or evening session. So I'm going to start with Jackie, who's going to talk about give us a bit of an overview of COVID vaccine in pregnancy and how it can help to reduce risk. So Jackie, if you speak for a few minutes on this, please, and then we'll hand over to Dr. Oggi.
Yeah, no problem. So as I said previously, I'm a midwife working in South East London, and I've been a midwife for 24 years. And so it's not unusual for us as midwives or anybody working in maternity to offer vaccinations in pregnancy. Many of you will know that we offer things like the flu vaccine and whooping cough as well. So it's not unusual for us to, you know, have to kind of talk to pregnant women and birthing people about vaccinations and that, you know, vaccinations are safe in pregnancy. I think my experience over the last 18-19 months since the pandemic started was that we were always a little bit behind initially, because obviously when the vaccination program started, pregnant women weren't being offered the vaccine, and that was because we didn't have a lot of data and we needed to make sure that it was a safe vaccine for you to all have. And as we've moved over the last, you know, the last 19 months, but it's not really, but you know, since the vaccination has started, there has been a lot more evidence now around the safety of the vaccine. I think we've had something like over 82,000 women in the UK have now been vaccinated, and a lot of our data comes from the USA, and we've got around over 160,000 people in America that has now been vaccinated with no adverse side effects. So this is a very well evidenced vaccine as showing that it's actually safe to have in pregnancy. And I think as a midwife, this has been a major part of my role since we've been vaccinating pregnant women and birthing people in giving that information and trying to help reduce the fear that there was for pregnant people, one about COVID and now obviously about having a new vaccine. So being able to share that information has been really, really important to enable people to make that informed decision about having the vaccine. I suppose the thing that I would also like to say is that what we are seeing in this third wave is we're seeing a significant number of women now who are more poorly with COVID. So there's more women in pregnancy that are being admitted to intensive care units with COVID. And that's kind of, you know, the Delta variant has kind of appeared, and it's causing a bigger problem in maternity units now, in that we are seeing more women admitted with severe illness. And as you can see on the screen, there's a few more stats for you there. But I think, you know, what the evidence is showing is that women are becoming more unwell in the third trimester, so towards the end of the pregnancy. And what we have found in South East London, and the data that we have been provided with, is that the women that are being admitted to the ICUs are unvaccinated. And that's very stark. So across South East London, we have these COVID huddles. All the trusts come together to learn and share together around COVID in pregnancy. And everybody has seen that rise in those admissions. And this is not to create more fear for you all, but it is just to show you that actually the Delta variant has caused significant more problems in pregnancy than originally. So I guess what we wanted to talk to you tonight is just to answer any of those questions that you've got. We're here to encourage you to have the vaccine, or all vaccinations, because they're all safe in pregnancy. We're here to encourage you to have that, but we're also here to make sure that all your questions are answered and that you feel well informed making that decision. Thank you.
Thank you very much, Jackie. We may come back to you in the question and answer session in the latter half of this, but thank you for that. Dr. Oge, can I ask you to talk about this from your point of view, about the different vaccinations and how you're finding delivery of these programs?
Thank you so much. So yes, I mean, it was just said, a lot of it was said before. I'm a GP, so initially, before I got involved with the COVID-19 vaccination program, I was involved with my local vaccination hub. So we were part of the hustle and bustle last December, feels like the other day, and I can't believe we're approaching a year since we first started the vaccination hubs, and we first had all the questions that we asked and all the concerns and worries about this new vaccine that seemed to come about really quickly. But the reason it came about quickly is because we're in a pandemic, and there was lots and lots of political will, global will, cooperation and collaboration to get us a solution out of this pandemic. And that came in the form of several vaccines. So we were not vaccinating pregnant women or women who were thinking of becoming pregnant at that point, because those women were not involved in the trials, like openly involved in the trials. So it was an extra precaution. Whereas as we have now gotten real world data, as we started vaccinating basically millions and millions of people, there's an observational studies done in particular in America and Israel that showed lots of pregnant women were vaccinated, lots of women who didn't know they were pregnant were vaccinated, and no harm was caused as they tracked those women through their pregnancy and after pregnancy. Hence why the guidance changed earlier this year, about April, to say please proceed and vaccinate pregnant women, because the risks of severe infection from COVID-19, especially in the later stages of pregnancy, are higher than the potential risks from side effects from the vaccine. So let us protect pregnant women. And a lot of pregnant women were very upset that they weren't offered the vaccination because they felt they were high risk initially. We did risk assessments at work, and as soon as you're 28 weeks, we said work from home, you know, so that was the guidance. We were protecting our pregnant women, and they weren't offered the vaccine, and people were annoyed at that. And then as the guidance changed, people were like, why are we changing the guidance? What's happened? How do we know it's safe? So COVID-19 vaccine is not a live vaccine. The vaccine itself cannot cross the placenta, but we do know that the antibodies, which are protective, cross the placenta to baby, and the vaccine can be taken at any stage of pregnancy. And you have to remember, I'm a GP. We have every year, we're now in the middle of the flu season. So we've offered the flu vaccine to pregnant women every year. We also offer whooping cough, and that's to protect baby in the first few months of life. So after 20 weeks, women are invited for their whooping cough or pertussis vaccine. So we have vaccinated pregnant women against infectious disease before. We now have data from over 160,000 women vaccinated abroad. In this country, over 82,000 in England vaccinated during pregnancy with no increased risk of adverse outcomes. Whereas on the flip side, we are seeing pregnant women admitted to hospital really unwell with COVID-19 itself. So we're here to just have a conversation, answer any concerns, because there are lots of legitimate and real concerns out there. So I always say it's a conversation. Come with your worries or any questions you may have. And I'm looking forward to that conversation again this evening.
Okay, thank you very much, Dr. Argay. Let's move on to Gurjinder, and you can take over now, and then we'll go into questions and answers after that. So.
Sorry about that. You thought we'd get used to this by now. So thank you very much, everybody. As I said before, I'm a consultant in infectious diseases, and I started during the pandemic working at Ealing Hospital, but I've moved to King's College Hospital. So I've come from a heavily Southeast Asian population to a much bigger Caribbean population. And it really has been quite a journey through this pandemic for us on the front line. We started with a phase where we were watching our brothers and sisters, people of the same age as us, coming in with severe COVID and being ventilated. We then went through an absolutely devastating period of time where elderly patients in nursing homes were just dying by the numbers, and we really lost a generation during that pandemic. But then Christmas was another time where once again we saw families, we saw lots of heartache, and they really didn't look like there was light at the end of this tunnel until the vaccination started. And Ogie mentions that the vaccination teams started working about a year ago, and they really, for us doctors and nurses and staff in the hospitals, the community, the GPs, the vaccinators were actually the knights in shining armour when it came to the battle of COVID. So if you imagine, during the first wave, we were getting up to 1,000 deaths per day. During the second wave, we were getting up to 1,200 deaths per day. But with a population that's vaccinated, that dropped down to 60 or 120 deaths per day. So we saw a very dramatic difference once the population started to be vaccinated. It works. We also noted from a social point of view, lockdown could stop. And we all notice people are out on the streets again, but actually we're not seeing dramatic rises because we have an element of immunity. But there was one part of our herd that remained non-immune, and that was the pregnant women. And so what we saw in this evolution of the COVID pandemic is a rise in the number of pregnant women that were presenting to the intensive care units. And as we've heard, most of those, 99% of those pregnant women admitted, were unvaccinated against COVID and had the Delta virus. What was more shocking was the news in September, where when we look at the most extensive form of ventilation, something called ECMO, where we physically remove your blood from the body, oxygenate it and put it back into the body, 1 in 6 patients on ECMO between July and September were pregnant women, and the majority of them were unvaccinated. And that's why we as healthcare professionals that have evolved with this pandemic, that have seen the impact it's had on different parts of our population, are extremely worried and scared for our pregnant women and would really want to be available to you, as we are today, to discuss any of your fears and anxieties. Someone had previously mentioned that data is starting to come through. We are all about evidence-based medicine. We saw how medications such as steroids, dexamethasone, absolutely revolutionized the way that we could treat our patients and became mainstream in hospitals across the world, saving lives. And similarly, data is coming out from all over the world, a study of 706 pregnant women across Africa, Asia, and Europe, showing an increase in maternal mortality and preterm birth when women in pregnancy catch COVID-19. We were also seeing data in a US study, which also showed the increase in preterm births, ICU admissions, and in-hospital mortality. And eventually it resulted in a risk of mortality that was 22 times higher in a group of women with COVID-19 diagnosis and pregnancy. Most of these were in the developing world who don't have access to the intensive care units that I have been referring to. Also in this study, it was apparent that quite a higher proportion of the pregnant women who were dying or had poor outcomes were from Black, Hispanic and BAME populations that we really do feel that we want to work more closely with to promote vaccination and really listen to what people's fears are. So as Ogie says, we are all about a two-way conversation, and we'll be very keen to hear any of your anxieties and answer any of your questions.
Thank you very much, Gurjinder. That was very comprehensive and very thought-provoking on the numbers and the who's actually suffered adversely as a result of this. So, colleagues, I'm happy to open this up now to questions from all of you on the call here. We've got one question from Gurpreet on the chat, and Gurpreet has asked, I don't know if you want to ask the question yourself, Gurpreet, or you want me to read it out. Do you want to unmute yourself, Gurpreet, and ask the question?
Yeah, so my question was, because currently at the moment I've conceived through IVF and I'm taking IVF medication. So I'm slightly conscious of having the vaccine or the second jab because I'm not too sure if there's been any research in having IVF medication and the effectiveness of the vaccine.
Okay, very good question, very pertinent. Can I ask Ogie if you've got any thoughts on that?
Thank you. No, really good question. So I'm kind of referring to the British Fertility Society and their recommendations. And so they've said that there's no reason to delay COVID vaccination for IVF treatment or during IVF treatment. So there's no known interactions between the medication that are given during IVF treatment and the COVID vaccination. You may want to discuss with your fertility doctors the timing. So in terms of, different aspects of retrieval or, transfer of embryos, etc. So just because sometimes after the COVID vaccination, people feel a bit run down, a bit feverish. So you may want to discuss the timing of the vaccine so it doesn't maybe coincide with a planned procedure as part of the IVF process. But there's no known interaction with any of the medication given during IVF. So the thought is it's better to be protection from COVID with the vaccination than not. So that is from the latest fact sheets from the British Fertility Society. I hope that helps, and all the best with the process.
Thank you very much. Don't go away, okay, I'm going to ask you to answer the next one. So is it Desiree has got the next question about fertility?
Hi, it's Desire. Thank you.
Desire, beg your pardon.
It's okay. I just wanted to know if there's been any data about effects on female fertility, especially in women of advanced maternal age.
Very good question again. Thank you so much, Desire, for that question. So there hasn't been any specific data on women of advanced maternal age. We know fertility, the pressure that society and biology sometimes places on us as women in terms of fertility. But in terms of COVID itself, COVID infection itself is a potential, risk factor because it can put people behind, make people tired. Long COVID can impact on plans for fertility, whereas the vaccination itself has not been found to have any effect on fertility at any stage. But there hasn't been, I can't say that there's been specific research at the moment in that particular group of women. Overall, the British Fertility Society said there's no biological or feasible way how the vaccine can affect fertility in the short, medium or long term. And women have gone on to fall pregnant after receiving the COVID vaccination in numbers as would be expected in the general population.
Okay, thanks very much.
Thank you. Thank you, Desire. I'm going to ask Gurjinder to answer the next one. So Tessa, do you want to ask your question?
Yeah, thank you. I feel quite reassured with the information we've been given about no increased risk of stillbirth and preterm labour and all these things. But the only concern that really remains for me that I'm still going through in my head is about the possibility of any long-term effects that it might have on the child and how we can be sure that there won't be any.
Very good question, Tessa. And please, may I reassure you that the placenta is a remarkable organ in the body, and its function to actually take antibodies from mum to protect baby is the very reason that Oki was mentioning earlier, that we will often give diphtheria vaccination to pregnant women, so that it is the antibody that you produce that you pass on to your baby to protect your baby. The vaccine cannot cross over the placenta because the vaccine is only in your body for a short period of time to produce the antibodies, and it's the antibodies that cross the placenta. What we have seen in very early studies was that there were a few cases where COVID virus did cross the placenta. So as has been the message so far, the evidence all points at the vaccine being safe in pregnancy and the greater harm coming from catching COVID to mum and baby.
Thank you very much, Gurjinder. Jackie, did you want to add anything more about pregnancy and the effects of COVID?
I think I just wanted to add a little bit there to what Gurjinder said, because the Royal College of Gynecologists have some very good information on their website, and they have actually said that there are a few studies now that have shown that the protective antibodies from the vaccination do cross the placenta, so helping the baby's immunity with sorry, my camera's not on, helping the baby's immunity against COVID. So these cases are coming through now where we're actually seeing the protective factor of having the vaccination to protect your baby. And completely agree with what Gurjinder said. We now have to consider the risks of not having the vaccination to your baby.
Okay, thank you very much, Jackie. Can you just stay on, and one of the questions that was asked previously was about when's the best time to have the vaccine while pregnant?
There is no time when a special time to have the vaccine. I would say if you know that you are pregnant, the best time to have it is as soon as possible. So there's no special time to have it in pregnancy. Get yourself protected as soon as possible. And you will have your second vaccine, your second one, 8 weeks afterwards.
Thank you very much for that. Any hands up or anybody wanting to ask a question, because we've got some other questions that were asked on our last session. Gurjinder, a number of people were worried about the fact that they had their first dose was AstraZeneca and having the second dose. I mean, I think that's less of an issue now as we've gone on and been giving Pfizer to pregnant women.
Yeah, I mean, again, this is part of the evolutionary nature of evidence and the evolutionary nature of the pandemic as well. It's not unusual. We have been in situations before where we do use one, that is where we have had to use one vaccine for the first and a different for the second in other infectious diseases as well. But as Oki pointed out, a number of vaccines across the world in many different countries came out at about the same time. and they've all shown effectiveness. And the purpose of the vaccine is to prime your immune cells to produce the army to fight COVID when they meet it. So it doesn't really matter which vaccine induces that immunity. We just go with the safety data as it evolves. And that's why, you know, I really think that, you know, even if you've had AstraZeneca, you must have the Pfizer vaccine afterwards, and then, you know, proceed as per the latest guideline.
Okay, thank you very much for that, Gurjinder. Can I ask you just one more question? There are a lot of people still getting COVID every day. So we can see on the news there's, you know, 45,000 new cases of COVID. If somebody who's pregnant has COVID and had COVID, when should they get the vaccine afterwards? Should they still get the vaccine?
Yeah, I think you still should. There is anything we can do to optimize your immunity, because we still are learning about how COVID can affect a person, and some people have caught COVID twice as well. And protecting yourself throughout pregnancy is important. You are getting an element of immunity from having the from catching the virus itself. In terms of when afterwards, I mean, Ogie might need to correct me, but I think you do need to wait about a month or so. But Ogie, could you come in on that? Because I just wanted to be certain that there was a...
So 28 days is the recommendation from active infection to getting jabbed. And I'd always say, make sure you feel well with no fever, or there's lots of flu. My whole triage list this morning, people with cold and flu-like symptoms. So maybe avoid getting vaccinated if you feel very run down, but definitely 28-day gap from active infection to getting jabbed.
Okay.
Thank you very much. So still important to get vaccinated, even if you've had COVID, and to leave it a month from the onset, from not the onset, but from having symptoms of COVID. And then if you're generally feeling very unwell with some other virus, then you shouldn't get it at that point, but at a later point. Okay, so Tessa's got another question. Tessa, did you want to ask that one?
Yeah, that's fine. I just wanted to know a bit more about like the statistics of the pregnant women that are like becoming really unwell and in hospital. Like, is it people that are otherwise well, or is it people that are like pregnant with other comorbidities?
Gurjinder, you're probably best of place to answer that one.
Yeah, to be honest, earlier on we were seeing COVID impact a lot of people from Black and Asian minority groups and diabetic patients, hypertensive patients. And then as the population started to get more vaccinated, the risk factor really is pregnancy, and you don't have to have other comorbidities to be sick and be unwell on a ventilator. So the main risk factor is the pregnancy itself. Okay,
so that's often women don't have anything else that leads them to be vulnerable in any way. Gurdev, you've got a couple of questions. Do you want to ask them?
Yeah, sure. It was just basically monitoring the email account that we have open. We've had a few questions come in from different people. Some of them are around breastfeeding, so the safety in having the COVID vaccination whilst you're breastfeeding, and if there's any implications there.
Okay, Jackie, can I ask you to come in on that one?
Yeah, absolutely. Sorry, my answers are very similar tonight. There are no risks. Basically, if you are breastfeeding, you should continue to breastfeed. If you're breastfeeding and concerned about having the vaccine, you should absolutely get the vaccine. There is no evidence that it causes any harm to the baby. And in fact, breastfeeding and breast milk works in a similar way to the placenta, in that you pass on your antibodies and immunity to the baby via the breast milk. So it actually, hopefully, as more evidence comes through, we'll see that it has a protective factor for the baby.
That's great. Thank you very much. One of the other questions on the chat is how is COVID-19 vaccination being monitored in pregnancy? So we are working with all of the maternity units to look at uptake of COVID vaccination in the group of women that they are looking after in the maternity units. And okay, I don't know if you've got any data on what kind of uptake we have at the moment. Have you?
I don't have up-to-date data on that, but in terms of the monitoring, there's the yellow card system, so anyone can report any. That's more for adverse reactions, so anyone can go online and report any potential reactions to the vaccine. As clinicians, we were asked to feedback on any pregnant women that were vaccinated before the official guidance came to vaccinate them. So before March, in particular, up to March, there was something called the UCOS UK TIS study that looked at all pregnant women that received vaccination, COVID vaccination, before that date. And I know that, for instance, one of my patients received AstraZeneca, because she didn't know she was pregnant. And so we've been asked to report back on that. And she's been followed through by what was Public Health England, now UK Security Agency. So there is definitely, we have so much scrutiny and oversight over this vaccine in all regards. And pregnancy and fertility is one of the big concerns. So there's just a study done at St. George's to show the difference between a group of vaccinated women versus non-vaccinated, and the rates of stillbirth and miscarriage are no different. So that was just published in an American journal recently. So the information is there, the scrutiny and oversight is there. It is still ongoing, so please be reassured by that.
Thank you very much, Aggie. Daisy, you've got a question. Did you want to ask it? And I'm going to ask Aggie to stay on and answer it if you can.
Hi, so I was just wondering what research has been done or is going to be happening about the vaccine and how it is impacting menstrual cycles.
Thank you. Really common and really good question. So lots of reports from women after vaccination about their periods being, irregular or heavier bleeding or unexpected bleeding. Usually it settles down after a couple of cycles, but the Royal College of Obstetrician and Gynecology, and I saw that the British Society of Immunology also are collecting data and doing extra observational studies on this. So they are definitely looking into it. Reassuringly, after vaccination, it seems to settle down quickly, so it's not thought to have any long-term effects. On the flip side, I've looked after women with long COVID who 9 or 10 months later are really disrupted in terms of their menstrual cycles, and it's not settled down yet. And there's general lethargy, and lots of long COVID has a wide spectrum of symptoms, but I know that menstrual disturbance is in there. So even though anecdotally women have reported it after their vaccination, not all women get it. Some have, and definitely this is what I think it tells to the scrutiny of this, because it's been reported in and it is being looked into. It's not thought to have long-lasting effects because it settles down quite quickly. But the research is being done. And if anyone had any effects like that, I would encourage you to utilize the MHRA system and report it on that yellow card system, which you can do quite easily online.
Thank you very much, okay. So on a previous call, we did have some issues from family members who didn't want women who were pregnant to receive the vaccine. I don't know, Jackie, do you have any thoughts about how we might manage some of those issues? We're happy to include them in these calls as well, aren't we?
Yeah, absolutely. I mean, I think, again, it is about having, as we've said, over the evening, it's about having that two-way conversation. I think that it is particularly difficult, and I would say as a midwife personally, I would want to talk to those members. I'd want to kind of, if it was a family issue, I would want to kind of talk to the whole family about what the concerns are, because sometimes someone might think they know what someone's concern is, but it's not until they actually start talking about it you get to the true picture of what's going on. And I think, again, it is about sharing all the information, all the evidence, all the very reassuring data that we have that this vaccine is safe to have in pregnancy. I think it is just making sure that that information is shared wider than just the pregnant woman and the birthing person. It is about engaging with the families, and I think that it's about information for society in general, because this is so important, especially for the pregnant women and the birthing people, and subsequently the babies that are going to be born. So I think sharing widely and being able to actually talk and have one-to-one, or however many people might be in the family wanting to talk, it is really important. And as midwives, we would be doing that if that is a concern for families.
Thank you very much, Jackie. Are there any other questions at all that people have got? If not, I wonder, Jinder, if you'd mind.
Could I?
Yeah, sure. I was going to ask you to talk about flu vaccination a bit, but you can talk about something else if you like.
Well, I just wanted to go back to Tessa's question, actually, because I've just had a quick look at the sort of ITU data to look at those comorbidities. And as I mentioned, diabetes and hypertension are up there. But the two I didn't mention in pregnant women that had sort of poorer outcomes with COVID was obesity and older age as well. And I think a lot of that around obesity does evolve around the mechanics of ventilation. And that does actually lead on to flu quite nicely in some ways, because influenza's always scared me. And, as an infectious diseases consultant, even before this pandemic, I used to really feel quite saddened that young people could die from influenza, and young people can die from viruses, and particularly pregnant patients. And we saw this with H1N1, and we saw quite frightening numbers of pregnant women needing ECMO and needing ventilation. And we always promote the influenza vaccine during pregnancy. It is a vulnerable time. We have got data that it is safe to have that vaccine, and we don't really know how this particular flu season will pan out, and we really want to make sure everybody is vaccinated. So getting a COVID vaccination, get the influenza vaccine as well. And I think again others can advise on timings, but I believe we are recommending that we try to get both done at the same time.
Yes, thank you. That's certainly the advice, if possible, to have them done at the same time. Okay, if somebody doesn't manage to have them done at the same time, can they have them separately quite happily?
Yeah, and we used to be that we were saying we leave a 7-day gap between any vaccine and another, but that requirement or that suggestion has been lifted. So logistically, it may be that your GP practice has the flu vaccine, but they don't have the COVID booster. You need to go to one of the vaccine hubs. So just get it at the first offer. You may go to your pharmacist for the vaccine. You may be offered both. So the key thing is to get it as soon as you're offered, and you can have it on separate days, but you can also have it together. A lot of the antenatal clinics are also offering vaccination clinics, so that's another place. So lots of options to promote convenience for women, because obviously women are busy with general life as well as dealing with pregnancy. So it is about convenience. So a lot of places are now a lot more available. And if you put it into the National Booking Centre, your details, and your postcode, you can find the nearest vaccination sites to yourself for the COVID vaccine. A lot of them have flu, but if they don't, pharmacists or your GP all have stock at the moment, or should do.
Thank you. So, Iman, do you want to ask your question about the booster? And I might ask Gurjinder to answer it, if that's okay. sorry, have it's I'm not sure I've called you the right name. That may be incorrect. Did you want to come on and ask about the booster? Or well, let me ask it for you. So Jinder, you can read it yourself.
As I was alluding to earlier, that the whole process of vaccination is to prime your body, prime your immune system, so that it is ready to fight the virus if you encounter it. Each dose of the vaccine you give teaches your immune system how to respond to that virus. And the reason we call it a booster is because it just lifts up the immunity one step further. It gives your immunity a boost. And anything that can give your immunity a boost will prevent and reduce your risk of catching COVID.
Okay, thank you very much, Gajinder. Whilst you're there, would you mind answering the question that Tessa's written, which is that what if after a period of time the COVID vaccine isn't found to be as safe as we expect? Is there anything in the vaccine that could scientifically harm the baby in terms of the ingredients?
No, and I think one of the things that we have all in the medical profession become very wary about is those really quite non-scientific sort of publications that were relating autism risks to MMR vaccination. And what we experienced in the pediatric world, general practice world, and infectious diseases world were people and children and families and adults coming in with MMR and suffering more from the consequences, and things like infertility and other sort of complications of those infections. And so there is nothing that has been identified in any of these vaccines that would be considered to be a risk, or has in the past been considered to be a risk. And we aren't seeing that kind of data at this point in time, but we have experience from previous vaccinations. And on the one occasion where concerns were raised, it was really false science, and those concerns were refuted and did more damage than good.
Thank you very much. Yes, I think it took many years for the MMR programme to recover from those claims, and even after a lot of evidence came through refuting those issues. Okay, I think we've probably come to the end of our questions from those participating in the webinar, unless anybody wants to put their hand up or speak out about anything.
Angela, it's Jackie. I think I just, sorry, and if this has already been said, but it's just to reassure people that the COVID vaccine isn't a live vaccine.
Yeah.
So there is little risk of infection being carried over to the baby. I just think sometimes people think that they're getting a dose of the COVID vaccine within the vaccination, and it's not a live vaccine.
That's a very good point, Jackie. Thank you for emphasising that. It's really important. Okay, so Tessa is typing a question. So if colleagues don't mind just hanging on, or maybe she's not. Okay. So if there aren't any more questions, what I'm going to do is to, thanks Tessa, is to say thank you very much to all of you for coming on this call this evening. I do hope that you found it of use, and I would particularly like to thank Jackie, Ogi and Gajinder for their time and their expertise in answering the questions. Once again, there's a doodle poll for evaluating this session, and if you have any questions, we're always happy to answer them. So thank you all very much, and I know it's 15 minutes early, but if there are no more further questions, we'll close the session. So thank you everybody, and have a good evening. Bye bye.